Today, I'm going to show you how I examine a hip joint and the pertinent points to focus on in your consulting room. One of the main reasons to examine a hip joint is to assess the level of dysfunction associated with arthritis of the hip joint. If somebody has a very stiff hip and is unable to put her shoes and socks on or get in and out of a car easily, then surgery may be very beneficial for them. The hip examination starts by watching the patient walking into your office. You want to observe the presence of a limp, a waddling gait, or a short leg gait by observing the relative height of the shoulders. I then perform a Trendelenburg test to assess the functional capacity of the hip joint. You ask the patient to bring the non-affected knee up to their chest. This flattens out the lumbar lordosis and shows that any further hip extension comes from the hip joint. You watch to see if the affected side can be placed flat on the bed. Range of motion, particularly internal and external rotation inflection, I find is closely associated with functional limitations for the patient. Abduction is also important. It is important to stabilise the pelvis before you examine in this plane. Next, you check the leg lengths. Checking to see that the pelvis is square on the bed, you simply look at the relative heights of the medial malleoli with the legs straight. If there is a difference, the simple Galeazzi test helps delineate if the discrepancy is either above or below the knee. Once you know the level of dysfunction of the patient, then you can interpret any subsequent x-rays with a much clearer picture and refer accordingly. Thanks for listening to these GP education tips brought to you by Ramsay Health.